Hello, I'm Dr. Sarada Pasangulapati. I'm a gastroenterologist at Yashoda Hospitals, Somajigura. Today, I've been given a few questions that are commonly asked questions on Google, and we will try and give answers to some of them. The first one I have here is, how can I clean fatty liver at home? Before getting to the process of cleaning of fatty liver, let us talk about what fatty liver is. Fatty liver is nothing but a deposition of fat inside the liver cells. So this can lead to inflammation of the liver, which can be evident on liver blood test called liver function test, and also can lead to scarring of the liver, that is stiffness of the liver, called fibrosis or cirrhosis at a later stage. Yes, fatty liver can be cleaned, or fatty liver is fully reversible, and this can be achieved at the early stages with just lifestyle changes. The first one is diet. Reducing the amount of fat as well as carbohydrate in the diet, which leads to weight loss, will automatically reduce the fat in the liver. And secondly, exercise. Exercise, even in the absence of weight loss, can cause huge changes to the liver. And this is good for the benefit of exercise for heart disease and stroke risk, etc., etc. So the first thing is, yes, fatty liver can be dealt with at home, but what is really important is the assessment of fatty liver and understanding of the stage of fatty liver, and then proceeding on to what lifestyle changes can be made. Now, moving on to the next question. I think it's very similar. Can lemon remove fatty liver? Unfortunately, there is not a single medicine or single nutrient source that can remove fatty liver. Fatty liver can be removed or cleaned by a combination of lifestyle changes that we've discussed earlier, which is diet and exercise. Number 3 question I have here is, how can I relieve acidity at home? Are there any specific foods that can reduce acidity? Now, firstly, acidity can be because of excess acid in the stomach, which can cause abdominal burning and pain, or it can be excess acid in the food pipe, different disease. That is because of loosening of the muscle that guards the reflux, that guards the acid in the stomach. So the food pipe and stomach are separated by a valve. If this valve becomes loose, acid can travel up into the food pipe. Food pipe is much more sensitive to acid than the stomach. So how can we relieve acidity at home? Simple antacids can temporarily relieve acidity, and any foods, most people find relief with milk or buttermilk sometimes. So any food to neutralize the acid also can reduce abdominal burning symptoms. Obviously, the less spicy food. So foods that are low in spice, low masala, and low in the sour content. So these foods necessarily worsen the acidity. So avoiding these foods and taking temporary antacids, or sometimes taking an occasional drug called proton pump inhibitor, or what we commonly call as Pantocid, or similar drugs, can occasionally help reduce acidity. But if this symptom is occurring frequently, then one needs to discuss that with the doctor. Right. And the next question I have is milk good for GERD? So let me first explain what GERD is. We just discussed earlier. GERD means gastroesophageal reflux disease. So the acid, which is meant to be present in the stomach to help digest the food and go down, comes back into the food pipe, causing reflux or damage to the food pipe. So this is called gastroesophageal reflux disease, or GERD. Is milk good for reflux? Milk can be good, temporarily relieve the symptom of reflux, that is heartburn or throat burn, but it may not be good as a prevention for GERD, and it certainly is not good when consumed in large quantities, especially at night time. A lot of our patients, especially the elderly, have a habit of drinking milk at bedtime, and this is certainly not good for reflux. In fact, it could be bad for reflux. So one has to try, those who are prone to reflux or who have had symptoms of reflux should try and sleep with an empty stomach. This would mean that the stomach food should be consumed at least 1.5 to 2 hours before bedtime, so that most of the food is digested and has been emptied from the stomach, so that the amount of reflux is lower at night. So when one is horizontal, the amount of reflux is less. When one lies down, and because the effect of gravity is also removed, the amount of reflux is more. So lying down or sleeping with an empty stomach is a good idea for reflux. So consuming milk at night is definitely to be avoided. Now, what should I drink for acid reflux at night is the next question I have. What should one drink for acid reflux? As I mentioned, sleeping with an empty stomach is better. So no drink at night is best for reflux. But there are certain syrups which can certainly help reduce the amount of reflux. So syrups like Gaviscon or Instaraft, mechanism is in the name, it's called raft forming antacids. So they form like a layer above the acid pocket in the stomach, which then physically prevents reflux. So this is the only drink certainly that can avoid reflux at night, but any regular drink like milk or buttermilk are best avoided at night. So if one wants to consume milk, it has to be an hour and a half or 2 hours before bedtime. The next one is, can I cure IBS permanently? IBS is often a condition that relates to gut sensitivity, and IBS can be controlled. Permanent cure may be achieved with lifestyle modification, but it is often a disease that can be managed. So one has to identify the triggers causing IBS. It could be stress, it could be certain foods, it could be certain infections, and if this can be managed along with medication, yes, it is a very well controllable disease. Now, what are the 5 foods to avoid if you have IBS? Now, I wish it was as simple as that. There are no definite foods that are to be avoided and are suitable for all patients. The IBS diet is not universal, and the IBS symptoms are also not universal. So whatever diet that might suit one IBS patient may make the other patient's symptoms rather worse. So, but there are some common foods that I'd like to mention. First one is milk. A lot of patients, especially those with diarrhea, do not tolerate milk. Milk products or lactose-free milk and lactose-free milk products are not a major problem in these patients. So if one likes to have milk and has IBS, especially diarrhea predominant, there are various choices available like soya milk or almond milk. One can make almond milk at home as well. So these are options available. So number 1 is milk. Number 2, wheat. Okay, a lot of patients tend to suffer with increased bloating and pain with wheat. But the fiber content of wheat is also good, so it might actually help other patients with IBS. Number 3, which is one to definitely avoid, is highly processed food. The other foods that cause a lot of bloating, that are called high FODMAP foods, are certainly to be avoided. So things like chickpeas or kidney beans and all types of dals, these can cause excess gas and can make the pain of IBS worse. Finally, coming to fiber. So for some patients, especially with constipation predominant IBS, fiber tends to be good because it helps them excrete the stool better. It tends to bulk up the stool, and then the stool comes out in one go. The same fiber can upset the symptoms of IBS diarrhea patients. Very, very important thing about restrictive diets is patients automatically stop eating some things, and there is often weight loss, and there is often micronutrients, vitamin and mineral deficiencies. So too much diet restriction is actually very, very bad. Okay, so the next one and the last question I've been given here is acid reflux as dangerous as acid burns on the face? I think I'll have to go down into chemistry now. So the usual pH level is around 4 in the stomach, and when it goes down to 7, it's like alkaline. So when there is high acid level in the stomach can, as I mentioned, deal with it, because there is a lining in the stomach that is protective, and this type of cells in the stomach are also made to sustain acid. However, food pipe cannot. So yes, acid can cause burns, and these burns often lead to ulcers, but these do not usually leave scars like, say for example, the severe acid related burns that were discussed. These ulcers when identified at an early stage, can be completely healed over a long period of time if the ulcers can cause stricturing or scarring, and the scarring can progress and cause stricturing. Stricturing means closing or narrowing in the food pipe. This can often present with difficulty in swallowing, so food might get stuck, sometimes pills might get stuck. So yes, the acid causes ulcers. Ulcers can cause scarring. Most of these are symptomatic, so not the ulcers or the scarring happens without symptoms, so they can be easily identified and treated. So please keep asking more questions and we'll be happy to answer them.